What's important to understand is to recognize that we have seen firsthand evidence of how quickly the situation can change and with quite devastating consequences in different parts of the world with these variants of concern. And it doesn't take a lot of warning for them to wreak havoc wherever they might be. The numbers are going down overall, and I think that that's a reflection of what we're seeing with non mutant strains of this virus. That's obviously something to be very encouraged about. But if we deny the reality that these variants are here, that they rapidly spread, and that they can cause much more harm in terms of disease severity and death, I think we are walking into a very dangerous situation. And I think Dr. Tam very appropriately mentioned that they are smoldering in the background. They are a little bit more difficult to detect. It takes a little bit more time to actually verify the genomic sequence with these variants. And when they show up in big clusters. And I can't imagine that with using the same public health measures that we've used up to this point in the pandemic and not fortifying any sort of mitigation strategies anymore, that we can't foresee more cases of these variants and a third wave materializing at some point in the next several weeks. So I think we have to be cautious. I think we can't be complacent and look at what the situation tells us today, but look at what history has taught us and look at what happens when we don't keep our eyes open and nursing homes become decimated and strains become dominant in places like the UK over a period of a few weeks. That could happen very easily here in Canada if we decide to pat ourselves on the back prematurely here.
I know, but modeling shows that if we open up, it's a disaster in waiting. But even if we stay with the current closures here and there, reopening things could still be very bad. Is this a sign that there should be just stricter lockdowns?
I don't think we need stricter lockdowns. I think we need better support structures to maintain public health measures in a more vigilant fashion than we're able to do. Now, everybody can wear more than one mask. Everybody can potentially try to do their best to distance when they're in indoor places, but not everybody has the means to stay away from work, for example, because there's been no provision for paid sick leave for essential workers. There's been nothing done to ensure that standards are upped in places where workers are in factories or in warehouses where PPE supplies have been compromised and standards have not been monitored very carefully. We haven't done enough to help with isolation facilities for people in hard-hit communities. All of these situations are actually going to be disproportionately more affected by these variant strains. Similarly, we've done nothing in schools where testing has not been ramped up for asymptomatic cases. Can we anticipate that we're going to see the same number of cases with the existing measures? Probably not. It's going to go up. So we've got to improve things, I think, from a systemic standpoint to help out and fortify those mitigation strategies and not stand pat. If we do that, I think we're practically inviting a worse outcome in the next 2 months.
And some of those things that you're saying are responsibility of the provinces, like rapid testings that are sitting in warehouses gathering dust. They're starting now to distribute them, almost a year into this pandemic. But I want to talk to the vaccines, and we know the rollout is being so slow. But Pfizer, we hear, may not need to be stored at ultra freezing temperatures. Is that a game changer?
It certainly is. And certainly the fact that we're seeing that even one dose, for example, may have very tenable protective effects for quite a while is potentially a game changer also. But the issue is that no matter what, you still need to get vaccines into people's arms. And that hasn't been done quickly enough. And even once you do that, you're still looking at a lag of several weeks to potentially a few months to where full immunity is constituted between an individual level and a community level. So even with the best possible vaccine scenario, we've got to protect our vulnerable people while that immunity is being established. And that points to all of these systemic determinants that haven't been addressed, and identifying the disease with a better sense of aggressive testing capacity, etc. And that hasn't been addressed. And if we don't do that, we're still going to have a lot of bumps in this road over the next couple of months, and more lives are going to be lost unnecessarily. And that shouldn't happen.
Again, and you're right. And again, that is provincial responsibility, the testing of cases. And it's still sometimes quite difficult to get a test. But I want to ask you before we go, we spoke a few weeks ago, you and I, about hospitals being overloaded. And I want to know if you're still seeing that, and if you're seeing these cases of variants in your hospital firsthand, how do they differ from, I don't know if I should call it the classic COVID or the traditional COVID that you saw at the beginning of this pandemic? Those patients that you see that have a variant, how different is it from the other COVID? Are they passing away faster? Are the symptoms stronger? What are you seeing?
Well, I haven't personally seen a variant case that I've actually looked after myself, so I can't speak from my own personal clinical experience, nor any of my immediate colleagues, but I can speak to other colleagues across the country who have seen some of these cases, and they are certainly much more lethal. They seem to affect even younger people in a more detrimental fashion. Patients do appear to have more severe complications and die earlier and more unexpectedly than the non-mutant strains. And you don't have to look very far to see examples of this all over the world, whether you're talking about the UK or Ireland or parts of the US. And these variant strains are increasing in number. There were 7 new strains identified in the US just over the last couple of weeks. So we're playing with fire here if we assume that we're doing okay and that the wild type non-mutant strains are petering out and that things look good right now and we can take our foot off of the gas. That's not where we need to be. We need to remain vigilant while our vaccine effort ramps up to get us through the next couple of months. That's the big hump that we need to get over.
That's our weekly update from Dr. Abdu Sharkawy. Maybe, next week we'll have better news, fingers crossed. Thank you so much for this, Doctor. Have yourself a wonderful weekend.